Let me introduce myself first. My name is Yelena. I'm a registered professional nurse. I have been a nurse for the last 30 years, give or take. And about 25 of those I have been in home care. So I have worked in a hospital, I worked in hospice, I was a visiting nurse. There are very few things that I haven't done. It's probably easier to list what I haven't done than what I have done. And I am still in home care, and at this moment I am also an owner of Isabella Home Care Services right here in Westfield. The name is a tribute to my late mom. That was her name. We thought there was no better tribute than to name the agency after her. My grandmother was also a nurse, and my mom was an educator. So I'm from a family of strong-willed women. Now this month, I'm not sure if you are aware, but this month is an Alzheimer's Awareness Month. I know it's not the most pleasant topic, and I know a lot of people don't really like to talk about it, but it's here. And I think the best way to become aware is to probably be aware of the symptoms, of the treatments, of the options. Better be prepared, right? Than not. So, 5% of those that are affected by the Alzheimer's are between the ages of 65 and 74. 13% are between the ages of 75 and 84, and 33% are those that are 85 or older. So basically the risk factor for the Alzheimer's is age. News, right? It is estimated about a little over 7 million people, 200,000 more people in the United States are affected by this disease. And about 200,000 are actually people who are under 65. Those are the ones who have something called, hello, come on in. Make yourself comfortable. Please take some drinks, some snacks. Those that are under 65 are diagnosed with something called early onset dementia, and that's also, unfortunately, is on the rise. So dementia is an umbrella term, and Alzheimer's is just one of the types of dementia. There is also vascular dementia, there is also Lewy body dementia, there is also frontotemporal degeneration. So there are risk factors related to physical findings. For example, someone who had a stroke, which is a traumatic brain injury, basically, can lead to dementia. Most common early symptom is trouble remembering new information. So people remember what happened 25 years ago on the evening of October 19th, 1955. But they can't recall when is their doctor's appointment, even though they kind of have a recollection that they made it. So that is how it is diagnosed. So warning signs: forgetting recently learned information, needing to rely, and I'm sure you came across people who make notes to themselves and have sticky notes all over the house. Okay, I know you, you're laughing. You probably make, listen, I make them too, okay? Challenging to follow steps, so follow directions. For example, a recipe that you ladies have been cooking, and all of a sudden you can't remember the steps, or you can't remember the ingredient that goes into it. That is something to be concerned about. Confusion about the concept of time and place. quite a lot of people with already diagnosed dementia exhibit something called sundowning syndrome, meaning they get more confused after the sunset when it's dark. They can't, like during the day they are okay functioning, but at night they get more confused because they can't remember what time, what day, where they are. Vision changes, trouble reading, trouble judging distance, not necessarily related to physical change with the vision, not because it's glaucoma or cataracts or macular degeneration, but with the way the brain perceives and processes what you see. So those kind of changes. Trouble following or joining conversation, difficulty finding words or right words, misplacing things and not being able to retrace your steps to find things, poor judgment, forgetting to pay bills, forgetting to groom themselves, social withdrawals, people don't go out as much, people don't talk as much, people stay by themselves. Those are, and of course, mood and personality changes. Unfortunately, personality changes as well as dementia progresses. So those are the typical signs of dementia versus age-related changes. Not everybody who is forgetful obviously has dementia, and not all people with dementia start exhibiting all these symptoms all at once. They start slowly, they start gradually, they may or may not progress. So everybody makes a bad decision once in a while, right? However, if it's consistently making bad decisions and poor judgment, that may be a sign of dementia. Inability to manage money. Person goes to the store and is asked to pay something, gives the cashier money, and does not understand how much they're supposed to get back or if they gave enough. Losing track of a date, losing track of a season. Another example, unfortunately, something I have seen in my practice, a person does not realize what season it is and may want to go out in flip-flops when it's 0 degrees outside. Sometimes forgetting a word here and there obviously is not necessarily a sign of dementia. I forget words. I'm sure you forgot words. My son forgets words. He's 20-something. Misplacing things and not being able again to retrace steps. Do we lose things? Of course we do. But usually you can recall, okay, I was looking for my glasses. I remember having them last time in the kitchen. Let me go back to the kitchen to get them. Not being able to remember where the glasses are, or not being able to remember you had them last time there, may be a sign, a warning sign. So risk factors. Age, obviously. Family history. Unfortunately, there is genetic predisposition and genetics, and some medical conditions, for example, having a stroke or being in an accident that caused traumatic brain injury. Other risk factors that are modifiable, something you can do about it. High blood pressure. Why? Because high blood pressure leads to risk of tiny blood vessels burst in the brain, and that may in turn lead to progress of dementia. That is controllable. You can go to a doctor, you can adjust your diet, you can exercise. Same goes for obesity, physical inactivity, smoking. If you are, stop. Although, if you have lived to 85 and didn't, I'd probably say go ahead, because stopping is probably not good for you at this point. Excessive alcohol consumption and hearing loss, very, very important. Hearing is a stimulation to the brain. So if you notice that it's hard for you to hear conversation, or it's hard for you to follow conversation, or people are speaking, but if someone else speaks, then it's too much of a background noise that prevents you from picking up what is being said. It is very important to pay attention and to go get your hearing checked, and if need be, to get a hearing aid. Hearing loss is very closely related to development of Alzheimer's, just like a vision loss. Because again, sound and sight are stimulants to the brain. Once you lose that stimulus, that's when things start turning south. And of course, social isolation, because you have no one to talk to, you don't talk to anyone. That is not a good thing. Now, approximately 2/3 of Alzheimer's patients are women. Why? We live longer. And remember what's the higher risk for Alzheimer's age? We live longer, we have more chances to have it. Although majority of the women who are living longer also taking care of someone with Alzheimer's. People with certain medical conditions, depression, sleep disturbances such as sleep apnea, traumatic brain injury that I mentioned. People of certain descent may have a predisposition, such as people of African American or Hispanic descent who live with conditions such as anxiety and depression, are at a higher risk. Nutrition, lifestyle impact. Regular exercise, maintaining healthy weight, maintaining low glycemic diet, meaning low sugar or on the lower side sugar, not too many sugars and carbs. Keeping your mind active, playing games, playing board games, playing chess, playing cards, whatever it is that you like, play it. Getting a good amount of quality sleep. This is, I know, a pain point for a lot of people after a certain age. It's not enough to sleep number of hours. That sleep also has to be restful. So when you get up, you actually feel rested. It doesn't always happen. There are different techniques to go about it. There are medications, although you definitely should speak with your doctor about using medications for sleep. But there are herbal supplements, there are relaxation techniques, there are sound machines that you can turn on. Whatever it is that you need to do, but either the short duration or poor quality of sleep needs to be addressed. That is for sure. Of course, maintaining your blood pressure within normal range, which is lately under 120/80. It used to be different. That scale of the blood pressure used to be higher. The doctors don't want it over 120 anymore. So anything above 120 is now considered on a higher, like a risk. Sorry. Maintaining blood sugar, if you are diabetic, the blood sugar has to be maintained between 70 and 99 milligrams per deciliter. Having, again, just like having high blood pressure, what high blood sugar does, it destroys blood vessels, including the blood vessels in the brain. So maintaining healthy blood sugar level is as important as the blood pressure. Now, how is dementia diagnosed? General exam, medical history, medication, diet, vital signs, neurological examination. The doctor checks your reflexes, coordination, speech, sensation, of course, brain study, MRI or CAT scan. And there is a whole slew of cognitive tests One of them is called mini mental. I'm sure that at some point everyone came across that kind of a test where the doctor asks you what time it is, what date it is, who is the president, when was the last time you did so and so, right? That's a mini mental. And genetic testing, when there is a blood drawn specifically for biomarkers. So that is the test. Now, treatment. There are medications and there is cognitive rehabilitation where people are basically taught how to perform activities of daily living if they forgot. There is a connection between doing something with your hands and brain processes. So that cognitive rehabilitation quite often may include occupational therapy. So the doctor will tell you to chop something up or to put some sort of paper together, make a figure out of a paper, make a boat out of a paper. Because there is definitely, well, not definitely, there are findings that connect what people do with their hands and how their brain processes information. Another interesting, and there is some research that supports it, another interesting find, dancing actually is a good way to promote memory. Because in dancing, your body memorizes the movements, and that is something that helps the brain to process other memories. So that is something to consider. Now, if you are a caregiver for someone who is diagnosed recently with Alzheimer's, there are training programs available. There are certain things that you have to keep in mind when you communicate with people with Alzheimer's. You need to always approach them from the front, so they don't get scared. You have to establish eye contact, so you're talking with a person, not at the person. Call them by their name. Be aware of touch. Some people are okay with it, and some people get scared and even become aggressive if you touch them unexpectedly. If you want a person to follow direction, that direction has to be very short and very specific. Again, consider the time of the day if you're visiting someone, because the later in the day, the more difficult it is for them to relate to you, because they lose track of time, people, places. And of course, keep in mind that if, God forbid, there is a need to address these needs for someone, you have to plan in advance. You have to have some sort of financial plan, because there will be a time when the care is needed. Now, current research in development, and I did not have a chance to include everything because things come up every day, something new. So earlier diagnoses, including the biomarkers, the test for the biomarkers, is the most promising area of research. What is being tested are cerebral spinal fluid and brain changes along with the biomarkers. Molecular imaging, some compounds are being studied, and 4 already have been approved for clinical use to detect. So it's kind of like a dye, a color that's injected to detect those biomarkers. And cerebrospinal fluid test, also to test for the presence of biomarkers. However, that test is not standardized yet. There is a big there's a big difference in the interpretation of the results. So that test still needs to be standardized. And that is basically it. If you have any questions, if you have any comments about Alzheimer's, if you have questions about home care, if you have someone who is you taking care of who has dementia, Alzheimer's, by all means, I will try to answer the questions as much as I can. Just a disclaimer, this presentation was for informational purposes only. If you have any symptoms or concerns, you always have to refer to your primary care physician or primary care provider. Sure, go ahead.
I teach line dancing, and I have a large number of people who are in their 80s and 90s, as well as 50 and over. But they've been there for years. And I'm not saying it's a cure-all, but it certainly forces them to move, to memorize.
Yes,
to
absolutely.
be physically active and get social contact.
Absolutely, absolutely. So it gives them two outlets. One is the memory of the movement, and the other is socialization, which is perfect, which is wonderful. Yeah, absolutely.
I wondered, the slide that you showed right before this, was that mostly to differentiate between Alzheimer's and all the other dementias?
No, this is the research and development of the actual dementia. Alzheimer is one of the types of the dementia. The symptoms are pretty much the same. So it really doesn't matter which dementia, it's dementia.
How can you tell the difference? And does it matter?
It doesn't matter, but to my knowledge, the only way to diagnose dementia is post-mortem. So, I mean, does it matter? I don't think so. I mean, honestly. Yeah?
When do you know if a person who's living on their own and has the memory loss? I've put covers on she has a gas stove, so I do that. The neurologist said that she should not be driving, so she's not doing that. You know, she functions well per se. Her memory isn't great, but the thing is, she does live on her own. When do you know when it's time to be more active, like say have somebody, like an attendant or somebody to stay with her?
You would have to, I guess, visit on a regular basis and to see how the person manages day-to-day things. Does she remember to bathe?
Okay.
Does she remember to change clothes?
Yeah.
Does she remember to eat, or is she losing weight?
Okay.
If you see someone who forgets to address their hygiene, who loses weight, and this is something you see quite often with people with dementia, especially even when they are eating. Sometimes they pace, and because of that, they lose weight. Sometimes they're not eating right, and that's why they lose weight. Sometimes they forget because they don't, if they don't feel the need, they feel, okay, I mean, I just ate. That just was 9 o'clock in the morning. Now it's 4 o'clock in the afternoon. That person may not have had anything to eat.
Right.
So, how does the person manage finances? Do they remember to pay their,
No,
or
she doesn't.
that's already taken
That's already taken.
care of? Okay. What about shopping? She doesn't drive. Who shops for her?
I take her.
Oh, okay. So that's taken care of. What about cooking?
Cooking?
Yeah.
She uses a microwave.
Okay. And warms up something that was cooked before.
Right.
Okay. All right. Well, now I guess you just have to find out if she is okay maintaining her hygiene,
Yes.
if she's safe to get in and out of the shower by herself.
Yes.
Then I'd say, God bless. Let her stay and take care of herself.
Okay. So for now, until if there's any more drastic changes.
If you, right, if you notice the change like loss of weight, body odor, incontinence that she doesn't realize she has, then probably it's time, I would say.
Now, when you start something like that, is it difficult to find somebody as a caretaker to come in?
Well, you have options. Option number one, and I wouldn't recommend it, but it is an option, is to find someone through your family or friends. That someone may or may not be a certified home health aide. If that someone, even if that person is recommended, God forbid, gets sick, you have no replacement, you have no backup. And you as an individual have no way of verifying their background. We can't run their background. So it will be a little cheaper, not much, but it will be. So that's option number one. Option number two, come to an agency like mine, and we will find you an aide who is certified. We will verify her background.
Okay.
And if, God forbid, she's not available, we'll try and get you a replacement. We prefer, and patients themselves and families prefer to keep consistent aid in place, especially for someone with memory issues, because it takes time to develop a relationship, to get used to the person. You don't want new face every day.
Now, will this person, if she wants to go to the store, or does that person, can she take her to?
No.
No. So it's basically.
In the home, yes.
In the home.
Maybe there are agencies who will provide you with an aide who drives.
Right.
We don't. It's too high a liability, and I'll be honest with you. And I don't know if that aide has her own insurance. If she doesn't, God forbid something happened, then, so.
Okay.
Right. If you want the aide to go shop and in her car and you give her a list, she can go shop.
Right.
So at least that part will be taken off of you. She obviously will cook. She will clean the house. She will do the laundry. She will make sure your loved one takes a shower.
Right.
And safely and gets dressed. But yeah, so that's the care.
Okay.
Any other
I
questions?
know you did not mention any medication, and you were bombarded with medication on the advertisement.
Yes.
And I know they usually work at the beginning, and after they really don't work. I don't know if they made any progress.
There are some medications that are available now for treatment. Are they always effective? No. The problem is, by the time the person exhibits symptoms, the disease has already developed. The diagnosis nowadays, all these wonderful tests, the biomarkers, they're not routine. It's not something that you get checked or start being like, for example, a man over a certain age always gets a blood test for prostate, right? For issues with prostate. This test is not routine. It is not people are not tested on regular physical exams. By the time you get the symptoms with memory loss, with, hearing and not understanding, the disease is already there. So how effective can the medications be? There is something that I read very, very recently. I haven't had a chance to include it. There is a theory, there has been a theory circulated for a while that dementia, Alzheimer's, has a viral origin, that it has something to do with infection. And the promising part is medications that are currently used for people with HIV, antivirals, seem to show positive results with treatment of Alzheimer's, which kind of goes into the theory that it's a viral origin. So that is something very interesting to see how that will develop and see if it does prove effective. Sure.
It appears the government is doing a lot more research now because so many more people are being impacted by this. I know I've read something about people might relate to it, the drug thalidomide.
Mhm.
They say it has a totally different use now,
Mhm.
rather than what it was designed to. I've heard things about Ozempic, but I haven't done any research to
Right.
see where it goes.
Right.
I wonder, are there studies where, let's say you've been diagnosed for a year, can you get into a study, or would somebody be saying, we don't want to deal with you because you're probably,
I don't have the data to tell you for sure. I know there are studies. I don't know what the eligibility criteria for the studies are. I think it depends on the study, and it depends on whether or not you fit that criteria. Is there enough research? I wouldn't say so, unfortunately. You know, you see, I'm the only, my hope and idea is someone will come across a treatment or a cure accidentally. Just like they came across, what was it? Penicillin, yeah, that's one. But see, treatment of Alzheimer's or addressing Alzheimer's, it's not a sexy trouble, you know, it's not that attractive to look into. Is it important? Absolutely. But pharmaceutical companies are trying to find things that will bring them, as obviously they have to think about it, that will bring the most profits. I think a cure for Alzheimer could bring them a lot of profits, but I don't know if there is enough finances or enough money going into the research for cure. So I'm hoping that somebody will come across it while trying to treat something else, and oops, there we go. There is a cure that we were trying to cure hypertension, but guess what? It treats Alzheimer's.
I think what is probably going to help is the fact that all of our medical records are electronic now, and somebody will write an algorithm and start to, you know, say who's got these characteristics and how can we treat
The
this.
problem is that there are still, first of all, they're not unified through the country. So some do have electronic records, some have partial electronic records, some don't have any. So it would be nice if there was one system that combines all these records and that data. Yeah, absolutely. And somebody, like you said, somebody will write an algorithm to pull important information from a large set of data. But for now, you know.
What I see doctors do have a portal. Many companies do have a lot of data for customers. But if you go to another doctor's, if it's not connected to the agency, you
Precisely.
can't communicate. Why should everything go to the government or one place that you're forced to provide information such way?
It's a good question. It's absolutely wonderful question. Unfortunately, I don't have the answer. I don't have the answer. I know, perhaps again, coming up with that kind of a system requires a lot of money. I don't know if this is one of the things that the government wants to spend money on right now. It definitely, it's a big country, you know, there's a lot of us. So it's a lot of data to be put in the system, and the system needs to be safe. So it cannot be hacked, the data cannot be stolen. That's another issue, because every time there is a way to protect the data, someone genius comes up with a way to hack it. So that might be another reason why it's not all combined.
It's scary. It's scary.
It is, I agree.
I know my husband, when he realized he was starting, I'd ask him a question and he'd get this blank look and then he was afraid.
Yeah.
And it took me a while to figure out.
Sometimes people also know that these changes are coming upon them, and they make fibs. You ask them, Ma, did you eat? Sure I ate. I go into the sink, there's not a dish. I go into the refrigerator, it's empty. Ma, when did you eat? I eat. I told you I ate. And, you know, very strict look. Like, Ma, your fridge is empty. When did you eat? So, people do tell fibs.
I think it's an important thing to say here too. If you have a loved one who has dementia, you need to find support groups too.
Absolutely.
There's a lot that the caregiver thinks, well, I should be doing more.
Absolutely.
Sometimes you
Yeah.
just need a break.
Yes. Yes.
Get other ideas of how to cope with it from other
Right.
people.
Yes. Just, I don't know if you guys are aware, but just for your information, there is something called respite care. And Medicare covers, I believe, 2 weeks a year of respite care. So if you're taking care of a loved one with whatever disease, dementia, physical ailment, Medicare covers a 2-week stay in a nursing facility for that specifically as a respite. It can, I believe, I have to dig more into it, but it used to be that you can take those 2 weeks all at once, so you can break it and take a week here and say a week down the road, but they do cover it. So that is something to keep in mind. Perhaps discuss with the doctor, because they might help to ease that transition or that temporary transfer.
I remember my father-in-law used to go to a day program, which was a lifesaver for him.
Yes,
Because it
yes, there are
provided,
those.
Socialization.
The day programs, there are some senior citizen centers that run those programs. For the major part, they are covered by Medicaid or those long-term care services and supports. And the way, my understanding, the way it works, if the person chooses to attend the day program under the long-term care services and supports, they're not entitled to get help at home. And vice versa. If you do, if you're at the point where you cannot get out of the house by yourself to get into a car and be driven to those day programs, then you will get some home care services at home. So
I
that
remember
is
they would pick him up from my house and
Right.
drive him there.
Right.
It was really nice.
right.
But I was thinking, as far as we're talking about fundings and the
Yes.
government pay,
Yeah.
in the long run, the people from who have Alzheimer end up on Medicaid because they
Yes.
spend everything,
Yes.
and the government pays, so we
Right.
get much better
Right.
if they put money in research.
Yeah, I agree. I agree 100%. Because, but again, it's the government who thinks about the big picture,
Yeah, right,
you
exactly.
know? Any other questions?
I think we all worry when we forget something. I mean, I'm at the point, if I forget something, I think, oh my God, is it beginning?
Well, we used to have this joke. You can't cure Alzheimer's, but you can forget about it. If anyone has any questions, something you will think of down the line, here is our information. We're right here in Westfield, so call, stop by, ask a question. We'll try to get the answer for you.
So if I understand, you deal with home
Yes.
care?
Yes,
People,
yes,
so there's speciality.
yes.
Where is your office?
On Elm, if you know where the bar